Welcome to the another video of Clinical Parasitology Unit-2, first video, Helminths. 1 hookworm, Necator americanus and Ancylostoma duodenal. Pathogenesis. Entry, infective filariform larvae penetrate the skin, typically feet. Migration, via bloodstream lungs pharynx swallowed intestines. Attachment, adult worms attach to the intestinal mucosa, feed on blood. Effects: iron deficiency anemia, hypoproteinemia, ground itch, at entry site, respiratory symptoms during migration, laboratory diagnosis, stool microscopy, detection of ova, eggs, thin-shelled, oval, larval identification, occasionally in stool if sample is old, CBC, eosinophilia, anemia. 2 Ascaris lumbricoides. Pathogenesis. Ingestion, embryonate eggs from contaminated food/water. Larval migration, intestine lungs coughed and swallowed mature in intestine. Intestinal phase. O-nutrient malabsorption. Mechanical obstruction, heavy infestation. Appendicitis or biliary obstruction, migration. Laboratory diagnosis. Stool microscopy, detection of fertilized/unfertilized eggs. Imaging, X-ray/USG worms may be visualized. Eosinophilia during larval migration. 3 Enterobius vermicularis, pinworm. Pathogenesis. Ingestion of embryonate eggs hatch in small intestine, adults in colon. Gravid females migrate at night to perianal area, lay eggs. Symptoms: perianal itching, especially at night, disturbed sleep, vulvovaginitis in females, rare. Laboratory diagnosis. Perianal swab, Scotch tape test detects characteristic oval, flattened eggs. Stool examination is usually negative. 4 Trichuris trichiura, whipworm. Pathogenesis. Ingestion of embryonate eggs, larvae hatch in small intestine, migrate to cecum and colon. Adult worms embed into mucosa, localized inflammation. Symptoms: diarrhea, rectal prolapse, in children. Anemia, growth retardation, heavy infestation. Laboratory diagnosis. Stool microscopy, detection of barrel-shaped eggs with bipolar plugs. CBC, may show eosinophilia, anemia. 5 Strongyloides stercoralis. Pathogenesis. Skin penetration by filariform larvae, lungs, trachea, swallowed intestine. Autoinfection, possible hyperinfection in immunocompromised. Symptoms: abdominal pain, diarrhea, weight loss. Larva occurrence, rapid skin rash, respiratory symptoms. Laboratory diagnosis. Stool exam, presence of rhabdidiform larvae, not eggs. Duodenal aspirate or string test, more sensitive. Serology/PCR, in cases with low larval burden. 6 Microfilariae. A. Wuchereria bancrofti. Pathogenesis. Transmitted by Culex mosquito. Adult worms reside in lymphatics, lymphatic obstruction. Symptoms: lymphangitis, elephantiasis, chyluria. Tropical pulmonary eosinophilia. Diagnosis: peripheral blood smear, microfilariae detected at night, nocturnal periodicity. Antigen detection tests. Ultrasound, detect filarial dance sign. B. Brugia malayi. Pathogenesis. Transmitted by Mansonia mosquito. Similar to W. bancrofti, but limited to distal limbs. Diagnosis: nocturnal blood smear, microfilariae with 2 terminal nuclei in tail. Antigen detection/PCR. CLOA. Pathogenesis. Transmitted by Chrysops, deer fly. Adult worm migrates through subcutaneous tissues visible in eye. Symptoms: calabar swellings, eye worm migration. Diagnosis: daytime blood smear, microfilariae, diurnal periodicity. Serology, Visualization of adult worm in eye/subcutaneous tissue. MCQs. 1. Which stage of hookworm is infective to humans? A. Embryonate egg. B. Rhabdidiform larva. C. Filariform larva. D. Adult worm. Answer: C. 2. The ground itch symptom is associated with which parasite? A. Enterobius vermicularis. B. Ancylostoma duodenal. C. Wuchereria bancrofti. D. Ascaris lumbricoides. Answer: B. 3. A child presents with perianal itching. The most likely parasite is A. Trichuris trichiura. B. Enterobius vermicularis. C. Ascaris lumbricoides. D. Strongyloides stercoralis. Answer: B. 4. Which diagnostic method is best for detecting Enterobius vermicularis eggs? A. Stool sample. B. Blood smear. C. Perianal swab, Scotch tape test. D. Duodenal aspirate. Answer: C. 5. The barrel-shaped egg with bipolar plugs is characteristic of A. Hookworm. B. Ascaris lumbricoides. C. Trichuris trichiura. D. Enterobius vermicularis. Answer: C. 6. Which parasite may cause rectal prolapse in children? A. Strongyloides stercoralis. B. Trichuris trichiura. C. Necator americanus. D. LOA. Answer: B. 7. Which nematode can cause iron deficiency anemia? A. Ascaris lumbricoides. B. Wuchereria bancrofti. C. Hookworm. D. Enterobius vermicularis. Answer: C. 8. The rhabdidiform larva is typically found in stool in which infection? A. Hookworm. B. Strongyloides stercoralis. C. Ascaris lumbricoides. D. Brugia malai. Answer: B. 9. Which nematode can cause autoinfection and hyperinfection syndrome? A. LOA. B. Strongyloides stercoralis. C. Enterobius vermicularis. D. Trichuris trichiura. Answer: B. 10. Which of the following shows nocturnal periodicity in blood smears? A. LOA. B. Strongyloides stercoralis. C. Wuchereria bancrofti. D. Ascaris lumbricoides. Answer: C. 11. The adult form of Ascaris lumbricoides primarily resides in the A. colon. B. cecum. C. small intestine. D. lymphatics. Answer: C. 12. Which nematode can cause biliary obstruction due to worm migration? A. Ascaris lumbricoides. B. hookworm. C. Trichuris trichiura. D. LOA. Answer: A. 13. Calabar swelling is a clinical feature of infection with A. Brugia malai. B. LOA. C. Wuchereria bancrofti. D. Strongyloides stercoralis. Answer: B. 14. The vector for Brugia malai is A. Culex mosquito. B. Anopheles mosquito. C. Manzonia mosquito. D. Chrysops fly. Answer: C. 15. Microfilariae of LOA are best detected in A. nocturnal blood smear. B. daytime blood smear. C. stool sample. D. urine sample. Answer: B. 16. The filarial dance sign is seen in ultrasound of A. LOA. B. Brugia malai. C. Wuchereria bancrofti. D. Strongyloides stercoralis. Answer: C. 17. Which nematode causes tropical pulmonary eosinophilia? A. Ascaris lumbricoides. B. Trichuris trichiura. C. Wuchereria bancrofti. D. Enterobius vermicularis. Answer, C. 18. Which diagnostic technique is most useful for Strongyloides stercoralis? A. Perianal tape test. B. Stool microscopy for eggs. C. Stool microscopy for larvae. D. Night blood smear. Answer, C. 19. Which parasite's larvae migrate through the lungs during development? A. Ascaris lumbricoides. B. Trichuris trichiura. C. Loa. D. Wuchereria bancrofti. Answer, A. 20. Thin-shelled, oval egg is seen in stool. It is likely from A. Hookworm. B. Trichuris trichiura. C. Enterobius vermicularis. D. Bruchia malai. Answer, A. Thanks for watching. For more videos, subscribe the channel and like, comment and share with your friends.